Hello, I'm Dr. Lisa, psychiatric mental health nurse practitioner with Turning Point Psychiatry. Today, we're diving into one of the most commonly misunderstood topics in mental health: how to tell the difference between bipolar II disorder and major depressive disorder. These two can look almost identical during a depressive episode, but the treatment approach and long term management are very different. Let's start with major depressive disorder, or what most people simply call depression. In depression, mood changes are typically unipolar, meaning they go in one direction, down. People feel persistently sad, tired, hopeless, and may lose interest in things they once enjoyed. Energy is low, sleep and appetite can change, and concentration often suffers. Now, bipolar II disorder also includes depression, and often that's what brings people in for help. But what sets it apart is that at some point there have been periods of hypomania. Hypomania is a milder form of mania. It's not the extreme highs you see in bipolar 1. Instead, it might look like needing less sleep but feeling full of energy, talking faster, or having racing thoughts, feeling unusually confident or productive, taking on lots of projects, or spending more money than usual, or feeling more social, impulsive, or flirtatious. These episodes usually last at least 4 days, and although they might seem positive at first, they often lead to burnout, regret, or a crash into another depressive episode. Here's where things get tricky. Many people don't recognize their hypomanic episodes because they don't feel sick during them. They may just think, I finally feel like myself again. So when they go to a provider, what gets reported is only the depression. That's why bipolar II is one of the most commonly misdiagnosed conditions, often mistaken for recurrent depression. So, how do we tell the difference? We look for patterns over time. If you've had multiple depressive episodes, but also periods of elevated mood, increased energy, decreased need for sleep, and noticeable personality shifts, that's a red flag for bipolar II. Getting the right diagnosis matters because antidepressants alone can sometimes make bipolar II symptoms worse or trigger hypomania. That's why mood stabilizers, certain atypical antipsychotics, or combination therapies are often used instead.